Welcome, everybody, and good evening. I'm Larry Green, and I'd like to welcome you all to SJICN's San Juan County Schools COVID-19 Response Forum for Spring 2021. Our school leaders on the panel here will discuss present and planned actions going forward. Michael Soltman, former superintendent of San Juan Island School District, is once again serving as our moderator. I'm going to turn it over to Michael in a moment, but first of all, for all of you participating as audience attendees, please submit your questions for our panelists through the Q&A feature on your screen. Also, at the conclusion of the forum, we would greatly appreciate your response to a short survey so that we can learn more about your assessment of not only this forum in particular, but your suggestions for future forums, topics that you would like to discuss. This will greatly help us develop the platform to stimulate more solutions-focused conversations that engage our whole community in creating a more resilient and thriving quality of life for all. So Michael, let's get started.
Terrific. I'm so delighted to be here and to be able to do this second forum with these wonderful school leaders. And I just want to say at the start, I just appreciate each one of you so much for what you're doing and the work that you're doing in these most challenging times. I'd like to introduce Amber Paulson. Amber is with Kaleidoscope Preschool and Child Care Center, and excited to have someone on the early childhood area to join our panel tonight. Welcome, Amber.
Thank you.
You're good to be here. Carl Bruner is interim superintendent at Lopez Island School District, and it's great to have you with us. Welcome, Carl.
Thanks, Michael. Great to be here.
John Bogert is board chair at Shaw Island School District. John, how many students are in Shaw this year?
We have a total of 8 this year.
There you go. So John's got the answer for all of us in terms of this challenge. Is you just have 8 students. That helps. Good to have you, John. Welcome. Eric Webb is superintendent of Orcas Island School District. Welcome, Eric.
Thank you. Welcome.
And Fred Woods, superintendent of San Juan Island School District, in his first year in the position. And what a year, Fred. Welcome.
Thank you, Michael. Appreciate it.
Great. So I've invited each one of the panelists to say a few words of opening, and then to move right into answering the difficult question. And that is regarding school opening during COVID. We are getting guidance and guidelines from everyone. We're getting it from the CDC. We're getting it from the President of the United States. We're getting it from the governor. We get it from the New York Times. We get it from our local health officials and our local county health folks. So, what is the school district to do? And then in our state, it's a local decision. So you get a lot of advice and then they say, okay, it's up to you. So I am inviting the panelists to say a few words of welcome and then to talk about how they're navigating all of this information to get to some decision about how we're going to serve kids back in our buildings again. And Eric is going to start. Welcome, Eric.
Larry, Michael, thank you for hosting this forum once again. And we definitely appreciate getting this information out to our families and getting a chance to hear from the community in this type setting. You're right, we have no lack of guidance for the past 11 months. There's many others that you can add to that, the Department of Education, Washington Risk Management. You can boil all that down, and for me, and really, I believe Orcas Island School District and the community, it comes down to what we hear at the state level. It's great to hear things from the CDC at the federal level, but we have to remember that those are recommendations. We really turn towards the Department of Health of Washington and our local health authority, Dr. Frank James, with the science aspect of it. We also work closely with our unions, our faculty, our staff, our school board, our community to make that decision as we go forward. We always base it on the science and the safety of our students. So we take all of that information, we compile it together, and we try to make a determination, is this the right time that we bring students back to campus, and can we do it in a safe manner? That has been a challenge at times, especially when you get conflicting information or information that changes every couple days or weekly to make that decision. But it really comes down to, are you ready, and can you put those safety measures into place, and can you do it well with our students? And at that point, Orcas Island School District makes that decision then to move forward into an in-person learning model. And so that's really how we've gone forward with this. We knew from the beginning that there was two models, a distance learning and in-person. We would sometimes bounce between the two of them, and we do it as a team and to try to make that decision.
Mm-hmm. And what's your decision?
Our decision is that we really felt like we could bring students back safely at the first part of December, the first time around with K through second grade. We were open for 2 weeks. We had an issue with a positive case. We had faculty in quarantine. And so we had to back up. We had to fall back onto our distance learning model. We got through the holidays and really that difficult 2 weeks after the holidays. And on January 19th, we welcomed our kindergarten through second grade, plus our Montessori public, back to campus. And I believe we've been doing it well since then. February 1st, we brought back our third graders. And this week, yesterday, we brought back our fourth and fifth graders who have not had in-person learning for 11 months.
Oh, thank you,
So
Eric.
pretty exciting for us.
Yeah. Amber, who are you folks listening to, and how are you sorting through it, and what have you decided? And say a few words of welcome if you want.
Sure. Yeah, I'm excited to be here. I am representing the early childhood community primarily on Orcas. We haven't, and Lopez, I suppose, too. We haven't connected much with the San Juan Island folks. The majority of our guidance starts with Department of Public Health, and then, of course, is on a state level, and then is followed on a local level. And we have, Kaleidoscope has been open since June 1st. We chose to do in person June 1st. The guidelines at that time were very strict. The recommendations, I should say, were very, very small group sizes. We really had to make some significant changes that were costly in the short term. And then a month later, the recommendations were changed, and the money that we had invested to create multiple classrooms, bring on additional staffing, was no longer necessary. A frustration that we have felt along the way has been, as those guidelines change, we aren't always notified. But I do feel like the Department of Public Health has been listening to those recommendations, and when they do make changes to the 57-page document we're supposed to be following, they weren't specifying what those changes were, and so we had to try to decipher what those new rules were, and that was tricky, but they've changed that. They now give us what they're changing. It doesn't come out at a specific time, those changes. It could be, I think we've gone as many as 3 months with the same set, and then a week later they'll change it. I think the shortest period of time they've changed is in 4 days. So that's sometimes hard to keep up with because those changes can have significant implications to our programming. As substantial as, at one point we had 24 children enrolled in our preschool, and which was fine until they said, no, actually you can't do that. So now you have to make a new shift. The primary shift that we have focused on is outdoor education. especially living where we do, our resources are just so incredible in terms of the diversity of ecosystems out there. So I kind of call it my COVID silver lining, because we had an emphasis on outdoor education. Kaleidoscope was actually the very first licensed outdoor preschool in all of the nation. So it felt really validating for someone to come, higher powers come and say, actually, we're recommending that you spend more time outdoors. So it's been a huge shift for our program. And I feel like we've been able to support other preschools along the way as they're trying to find the most appropriate way to bring more outdoor time. And I really believe that COVID has done for outdoor education what we couldn't have done in 10 years. It's now important, and it's a good idea. It's not just, before it was kind of, fun and, give it a try, but now it's really become a focus. And I hope that continues because we've really embraced it, and the value to our children has just, I really, in 25 years of this job, I think that it's been the most satisfying lately with what the children are getting out of their experience. I really think, even with them coming out of the quarantine period and the desperation that our young community was feeling, it's really come full circle to a level of appreciation. So
thank you, Amber. I appreciate that. Fred, a few words of opening, and then who are you listening to, and what decisions are you making?
Well, I listened to Eric, but other than that, first of all, thank you for hosting this, Larry and Michael. I appreciate it. It's often hard to get into a situation where we can communicate with different members of the public, mainly because the information, just like Amber said, it changes so often, and you can release one communication and you need to back it up and change it maybe 2 days later. Well, I think the other superintendents were in a meeting today to listen to the state superintendent speak, and an interesting comment was made that by Superintendent Reichdahl that the CDC provides recommendations, but they take their guidance from the State Department of Health. And then he threw in the next step, which was, but the local health department has even more authority, and they don't always agree with the State Department of Health. And that's where we have been, this entire time. And because of that, I can kind of go back to the introduction part of this and say it was quite a year to become a superintendent in the middle of this and determining who do you listen to. I think that the issue about the local Department of Health is that they understand the community we live in. And so it's very important that we do. And we've said all along that risk management is an important part of the whole process. And we can move to open when we get clear guidance from the local Department of Health. But what makes this tough is that we do also listen to the governor, and we do listen to the Department of Health. Okay, something just started on my computer. I don't know what happened. And we listen to, well, for example, I wanted to bring up the governor came out at the beginning of August with a low risk, moderate, high risk counties that should open or stay remote, and it was based in counties. Then he came out with a new set of numbers not too long ago, where it was based on the rates per 100,000, but it changed to regional numbers, not just a county number. And our local health official has always operated on a regional. So it's been very difficult to determine who to listen to, but we've been very strict as island superintendents, having conversations with our local health department to make that determination. At the same time, though, when it comes to the protocols that we put into place to create mitigating situations so that we can move back into an in-person setting, we have to take a look at the Department of Health, the CDC, Labor and Industry, and as well as the Office of Superintendent of Public Instruction for guidance. And we also communicate with our unions, and then our school board is the one that ultimately makes the decision based on the information that is provided to them. And I hate to say it, but one of the things that we also have to be considerate of is also the budget, because when we do go back into in-person, it's usually going to cost a whole lot more, because we do have to live up to social distancing guidelines. So we have to be very creative in how we're doing it. And so it's kind of an entire picture, but to open is based on, our work with the local health department more than anything else. For San Juan, I'll just answer the question before you ask it, Michael. For San Juan, we opened up 1st of November. We planned at the end of October. We went through until Thanksgiving. We had a couple things that happened in our own campus, let alone what was happening over in Orcas. We made a decision to pull back until January 19th, and we went back in with our K2. Within 2 weeks later, we had 3 through 5 in. So we've had K5 in for I guess 4th and 5th started right before midwinter break. And on Thursday, our middle school opens into a hybrid. And I believe that we're looking at 10 days after that, we're going to be the high school will be starting in a hybrid situation. So that's where we are at this point.
Say again the timeline on high school, Fred. What are you thinking about with high school?
Well, I haven't released anything that's definitely publicly. We're waiting on one thing, and I do have a board meeting tomorrow, but we're looking at opening that up within right around the 2nd week of March.
Yeah. Okay. All right. Thank you.
Yeah.
John, welcome. Curious about Shaw and who you guys are listening to, if anyone, or if you're just on your own out there doing what you want to do. But let us know, say hello and a few opening comments, and let us know how you guys are processing this and decisions you're making.
Okay, well, thank you very much for including me in this. We're definitely the small guy on the block, and I'll keep my comments short. Our school is, as I said before, 8 students, 4 in K through 3 and 4 in 4 through 8. So we have 2 teachers. And as far as who we listen to all of the above. We have 0 cases of COVID on Shaw and have not had any cases at all during the entire pandemic. But we are very conscious of the other islands, and not only the other islands, but of the feeder ferries, basically, of people coming to the island. And although our main source of information, I believe, is Dr. James, and our superintendent, Jennifer Swanson, who I think you've all interfaced with, stays in very close contact with Dr. James, and we follow his recommendations for the most part. That said, our one teacher, K through 3, is a high-risk person, and that really drives our decisions on when to open and when not to open. So we have been totally remote since the beginning of this. And we're scheduled to reopen March 12th in a limited fashion. We have a small school, and as I said, just 2 teachers. We've just purchased an outdoor gazebo that, if you've been down at Cordis, you see along Commercial Avenue there, those gazebos outside of restaurants. So we're going to keep as much open air as we possibly can. And as Amber said, try to do as much outdoor learning as we possibly can. That's about all I can contribute to that. Our upper grades have had on and off in person, but it's all been outdoors and paying very close attention to the guidance as far as masks, social distancing, and the like.
Thank you, John.
So thank you.
Yeah. Carl, it's really interesting during these times to be an interim superintendent where you parachute into a community
Indeed.
and then solve all the problems. So say a few words of opening and tell us how what you're listening to and what you're doing over there.
Well, Michael, I want to echo my thanks to you and to Larry for making this opportunity available. Also want to thank all those individuals who are taking time out of their evening to listen in. I came to Lopez as an interim superintendent on January 4th, and I will be here through June 30th. And certainly, I don't have a lot to add to the question around who we listen to. It's similar to what others had said. What I can tell you is this, that on Lopez, what I've learned is that my colleagues in districts across the county have been tremendously valuable, not so much in talking about the science. We all rely on the Department of Health, individually Dr. James, for that information, but in helping me think about, okay, how do we translate that guidance from the Department of Health and what we're hearing from Northwest Educational Service District, our regional agency in Anacortes, and OSPI and the state. How are we sort of processing all of that and using all of that information to drive action in our island communities? Because we are very unique. And this is my first time serving an island community. And there are many things that are unique about it. And many of those things are positive. You know, one of the things I will add about the crush of information that we're all faced with is one of the more challenging aspects of that is that information gets translated into beliefs and strong opinions on the part of the public. And surprise, surprise, those opinions and beliefs are not homogeneous. They're pretty polarized at this point. You have some people who think you're foolish and uncaring if you try and bring students back. And you have some people who think you should have brought students back 6 months ago. So trying to make sense of all of that while at the same time being sensitive to your local community is always the challenge in public education. And it's even more of a challenge now, of course, because the stakes are so much higher. So here is what we've done. When I got here on January 4th, Lopez was suffering the effects of budget constraints and significant challenges and many community and board level and labor concerns around those challenges. They had also experienced some significant transitions as far as leadership goes. So my job was to go to our labor groups and say, okay, look, let's take a couple of steps back, figure out how we can put together a team to begin to look at this with fresh eyes and start to make some decisions about how to move forward. And that's what we spent the month of January doing. Through the month of January, we were, with the exception of serving some students with disabilities and some small groups of English language learners, everybody else was 100% remote. We made quite a bit of progress in planning during the month of January, and we came out into February with a plan to start kindergarten before midwinter break. What happened at that time was that we experienced, as the Lopez community, on a community spread like the island had not experienced previously. So that obviously caused some significant anxiety, and we backed off until after midwinter break. So today we started with kindergarten. We will start first grade on March 1st, and we have a plan to start our second, third grade class, which has one teacher soon, and then fourth and fifth grade shortly on the heels of that opening. So similar to John, we're challenged, and I think this is true of Orcas and San Juan as well, perhaps to a lesser degree. We're all driven by staffing. And if you have one teacher for grades 2 and 3, and that teacher is in a high-risk category, and they are not ready to begin for any number of reasons, and that creates a challenge. If you have one bus driver currently, who we do, and that person is in a high-risk category, that creates a whole nother set of challenges. And so you end up making some sort of idiosyncratic decisions based on the individuals who are in those specific roles. Having said that, we are poised to gain momentum the rest of this week and next week, and I think we'll really be in good shape throughout the month of March. I don't want to go on and on, but one of the more exciting things that we have been able to do because of teacher innovation and willingness has been at the secondary level. We've had a woodshop teacher who is opening up this week for secondary students in woodshop. We have a teacher who teaches primarily high school, but the class includes some middle school students in sustainable agriculture, and they have been coming in once or twice a week for a couple of months. We have an art teacher, we have a counselor who teaches careers, and both of those teachers are interested in reopening on a hybrid level for high school and perhaps some middle school students. So we're just kind of open to staff who come to us and say, you know, we're worried about our kids, and we would really like to do this or that or this other thing. And we entertain those proposals. We run them through our internal process that includes our school nurse. And then when we think they're strong, we take them to the Department of Health. And if they're approved, which they often are, if they're well thought out, then we run with them. So we have it's led to a bit of a patchwork quilt, elementary and different options at high school. And yet it's all about making opportunities available for students when and how we can.
Thank you, Carl. A lot of thoughtful work going on there. I want to say a couple of things. First, to those who are attending this forum, I am looking at your questions coming in, and I'm leaving some of my questions behind so that I can work those in. So keep sending your questions in. Carl brought up the whole notion of how homogeneous our parent group is and how they all agree on everything all the time. But I just want to spend a little bit of time on that because of social media and letters to the editors that I've read around our region, that parents and students and community have a strong desire to be heard on this issue and to feel like schools are being responsive to it. And there are some parents that just think this county in particular is just way too cautious, and that a lot more could be done if you just do those 6 things, right? Masks and distancing and tracing and those kinds of things. So how are you navigating that? How are you navigating that in a way whereby your students and your parents feel heard and that they have access to be able to influence the decisions that you're making? And then I'm going to ask the same question a little bit about staff. So I'm going to open this up and let whoever wants to jump in on this to go ahead, just sort of give us the signal and jump in, and we'll just have a little discussion. But how are we doing that? How do we make that happen?
As I said before, we have a very small island. We have 200 residents full time, and it's a very close-knit community. So the problems that are experienced, I think, in a larger school district, we don't have quite the difference of opinion and the sometimes polarity that occurs in a larger audience. Parents here talk among themselves. They have parent meetings, usually informally. And we as a board, and I'm speaking as a board member as opposed to a superintendent, we have constant contact with the parents. So we include the parents and the students in our decision making, as well as, which your next question implied, the staff. So we have modified some of the things that we've started out with as far as remote learning in response to parents' questions and comments and suggestions. And over the course of the time, it's worked out very well. One thing that's made our remote learning very successful, I'd say, is the fact that we were able to purchase document cameras for every student, and they're able to take them home. And so it's actually better for the teachers to be able to supervise the students with their document cameras rather than going from desk to desk 6 feet apart and masked and trying to deal with students and help them out. So students are able to share their work. The teachers are able to do real-time online corrections to their documents that they see, whether it's math or spelling or reading or whatever. So the parents have been very.
I think John froze. Who else would like to? Fred, let's hear what you have to say.
I'm not sure quite how to answer. I think when you ask how do you navigate it, that's a good word. I don't know if I have well at times, to be honest with you. I know that I'm sure the other superintendents would say the same thing, that we listen and we consider. There are some, in the course of one day, I may have 2 separate conversations with different either parents or different opinions, and they're polarized. And I do hear what they're saying and want to try to provide as much of an answer as I can. I think the navigation is to hear their input and know that it's valid, because it is their kids that we're talking about, and it is our community that we're talking about. And then also work with the local health officials as we make decisions to open. We do rely on the surveys. The surveys that we've sent out have shown some important things for us. That's an opinion that does make an impact and helps us shape what we're doing as far as moving back into an in-person and how that in-person will look. But at the same time, as we create an in-person program or a continued remote plan, we also have to consider what you'd say the other side of the argument, and we also need to consider what the Department of Health guides us on. I would have to say this has probably been, more than anything else, the most difficult part of the process for me, because I even have some personal beliefs that I think, I want to act on, and sometimes I can't do that. I've got to listen to what the Department of Health says, and we have to make a decision that is in the best interest of students, but also for our staff when they're walking back in, that they need to be in a safe environment. I've often said we cannot eradicate the risk we can't eradicate the risk, but we can mitigate it. And that's what we've spent so much time doing, is working through processes that would establish an opportunity for us to walk in and be as safe as we possibly can. But when you ask how we navigate, back to the original question, that is, I don't think I have personally found the best way to navigate, except for the fact that I am going to listen and to all sides, and then we're going to have to make the best possible decision that we can that will support this community in the best way we can. And it's not always going to please everybody.
So this is not a fair question, probably, Fred, and you can take it out on me later. But what do you hear from kids, and how do you assess what they're telling you about this?
Well, that's a fair question, and honestly, so there's 2 things. So I think, Michael, you know me well enough. I love being around students. It's just what so about a couple weeks ago or so, there was in January sometime, I'd have to check the dates, but the secondary campus put together pictures for students, and it was a 2-day event. It's around the time we lost electricity on the island for a whole day. But I left the office and went over to the location they were taking those pictures, because I just wanted to see students. And I took the time, actually with 6 different students, just to ask their thoughts. And of course, every one of them are wanting to get back in. And so in that, but they also were able to explain what was successful in our teleschooling model and what is not successful. And it's something that I could share with our administrators. So it has been important to listen to them as much as it is to listen to parents. And being the principal at Griffin Bay and bringing some students onto campus that are struggling support, that needed the support, it's been good to hear their views of what's happening to them and why they needed even a hybrid kind of situation in an alternative setting for them to get, for those students to get back on track is pretty meaningful to me when I'm trying to discuss with the board decisions about moving back to in-person. And I'd have to say some of the student input as well, the parental input, is what led me to present our hybrid plan in such detail to Dr. James. I think that it does have influence on all of us, and the students really do on me. They really do.
Who else? Anybody else have a comment about navigating this? Yeah, Amber, go ahead.
I would just add, conversation was really important for us after being out for the few months that we were. We have about 75 families enrolled in our program, and it was important to have conversation with all of them to try to establish where we were, because there are so many opinions out there, and you see so many extremes in each direction, I suppose, even in a small community. And one of the things that I realized quickly, very similar to what Fred said, was I repeatedly communicated that that there was nothing that we could do to eliminate the risk for our families and for our children and for our staff, but we would do everything we could to reduce it. And the next part of that conversation was, and we're in the position to be able to say, we don't have to please everyone as much as a public school entity would have to listen, I suppose. But it really came down to, if families weren't comfortable with that statement of doing everything we can to reduce it, then perhaps it wasn't the right time for them to join us. And there were a small handful of families that I said, let's check back in a few months. Let's see how this unfolds, and see where your comfort level is, because I certainly don't think it will do any program any value to force or demand that we are all happy with the steps that are being made. So, making sure that everyone has a certain level of comfort. And as a staff, it was actually interesting. We still are only open 4 days a week. We're only doing Monday through Thursday. It was a strategy we started. We also started with reduced hours because we had all been home in our pajamas for 3 months and a little unsure about joining the real world again. So a compromise was shorter days. We have extended our days, but not doing Fridays, not being open on Fridays, I think has been incredibly supportive to the staff, especially when we first started, and the responsibility of wearing a mask 8 hours a day while still speaking in a teacher voice. It's very different than, sitting at a desk or, talking over a counter. That teacher voice is really muffled, and you don't have the your other teacher tool of your expressions as much. So when we first opened, it was really difficult. I occasionally would get lightheaded. I remember reading Green Eggs and Ham, and I almost passed out. And I was in a group, and I had my mask on, and but I had to project so much more to reach the children that were further away. So we had a conversation about, if you ever find Miss Amber asleep in the classroom, you need to get another teacher, because it was just me and 8 kids, because that was the rules at the time. We weren't allowed to have, other people coming in or checking on you. So I think being respectful of where the staff was coming from at the time we reopened, and then still moving forward, has been key. We also have really encouraged just the self-care component of getting some counseling, seeking, just being able to have conversations during really trying times with professionals. We've found online counseling programs for our staff through a EAP, employee assistance program that we offer. And I think that's been really valuable, to just, because it's hard and you kind of feel a little crazy sometimes. But we're all working so hard to keep it together that you don't realize just how vulnerable we are all feeling as teachers. But in that same breath, incredibly appreciated by the families. And that's been really inspiring.
Thank you, Amber. Eric, you have a comment, and you're on mute.
Can you hear me, Michael?
I can.
Just a couple little short comments. I think everybody has covered this topic extremely well. I think for Orcas Island School District, in a lot of ways, we have really strengthened our relationship with our families during this time. We have lived in a world of Google Meet and connecting more often with our families, surveys, and also we've seen administrators having question and answer sessions with families frequently. And really, it goes back to those conversations that we're having. I think Amber's correct. Most of the time, we're finding our parents have one or two questions they would like an answer for those questions. And in a question and answer session, it's easy to do that, and we can answer that question. So I think in a lot of ways, we're doing a much better job, even during this pandemic, than what we did before. And it's one of those things on the other side of this pandemic that we really want to keep in place, that quick communication through Zoom or Google Meet. The one thing I think for us, for me, definitely, I think we could do a better job of is hearing from our students. A lot of times what we hear is from the parent who's very happy with what we're doing or not happy with what we're doing. And that provides us the opportunity to share exactly what we're doing and explain to them why we're doing it that way. But a lot of times that's lost on the students. Mm-hmm. So for us, thinking about how do we come out on the backside of this with the student voice and understanding that a little bit better in our district, and inviting student reps to the table to sit with our school board to ensure the fact that we're getting that student voice and hearing that. The other thing is, how do we navigate this? We've been fortunate that we're able to provide options to our families. And a lot of that is because of our size of school that we are. And we're able to offer Orkila, if you'd like to go out for that Orkila day, K through 8, or would you like to select 3 days at the elementary school, and we'll accommodate that. If we know what the need is and why, and understand why the family has that need, we can work with them. That's been the advantage for us. And that's how we've navigated a lot of this. 70% of the families on Orcas is asking for their students to come back to campus. I have 30% that I need to work with. They're not there yet. They're not comfortable. They might be in a couple of weeks when they see how we're performing here at the district. But we also have those other options to provide to them and work with them until they are comfortable having their students come back. Some of them may not at all this year, but because we're limited in size, I think that's to our advantage. And
Eric, what do you think? Let me ask this: what do you think about, from a kid's perspective, from students' perspective, and this pandemic to them is surreal, right? In terms of context, like what the heck happened here, and the effects on them of being in the pandemic. In some ways, some people believe it's far worse than whatever the effect of the virus might have been on a few of them. And how do you sort that out?
Well, the academic side, the interesting thing on this is that, I'm out front at the drop-off area, and we welcome third graders back February 1st. And a third grader, after doing a health screening check with their mask on, temperature, they get out of the car, they come into the building, they're carrying their box of school supplies. And you can tell underneath that mask, they're beaming, they're smiling from ear to ear. They are so ready to get back into the classroom. Debriefing with the teacher after that day is the fact that we have new and different learners. We have independent learners. We have third graders who have been at home kind of responsible for their learning, their education. They are empowered. How do we keep that going forward? How do we keep that in place and capture that over the next years? That's what we want to keep coming out of this crisis, right? We never let a good crisis go to waste, you know? That's very important to us. And of course, there's the social and emotional aspect of it too. The number one thing for us as students come back to the campus is to build that relationship, to check on them, to make sure that they're doing well social and emotionally. And we've had that with Camper Kyla, and we've had that with athletics at the high school and clubs at the high school. We can check on them that way. So it's really looking at that and understanding that we're really dealing with a new type of learner that we haven't had before.
Thank you. Thanks, sir. I want to move on and ask some questions about staff. And I thought that Carl and Amber sort of went into that territory, and Carl was starting to describe actually what I heard a state official say the other day, and that's that, well, most staff are probably going to be okay, but you're going to have to make accommodations for the ones who are potentially under much greater threat from this, and be responsive to that. And I heard Carl making some adjustments in that. You know, in some states like Oregon, they're saying that they're going to vaccinate teachers before they come back. In our state, the governor said, no, we're not going to prioritize teachers, at least so far. And so I think that's put you folks in an interesting and difficult position of how do you assure safety for your staff and encourage them to come and do hybrid and in-person learning? And how are you navigating that? Who wants a shot at that?
That is a conversation that is ongoing. And it doesn't matter if you're in a group of 200 superintendents, if you're talking individually with Chris Reichdahl from OSPI, or you're talking to the Lopez Island School Board. It's a hot topic. And when Eric and Jennifer and Fred and I talk to Mike Tompkins and Dr. James about that in our weekly meetings, they make a good point, and that is, look, yes, teachers are a priority group, and yet you can put them wherever you want to put them, but until the supply chain problems are addressed, it's not going to make a difference. And we know on Lopez and every one of our islands, as well as the mainland, we have people who are currently and have been for some time eligible for the vaccine who have not been able to access it. And so that's part of the bigger problem. And so we're trying to walk that line by, and I think I speak for most of us, if not all of us, advocating for teachers being moved up the list beyond where they have been, while at the same time recognizing that it's not realistic to think that we're going to be able to get everybody in one of our schools or two of our schools or more vaccinated quickly.
Mm-hmm. Anybody else?
You know, Michael, I think one of the things with this is there's the vaccine part. And I have to say that teachers are waiting patiently for that time to come, like a lot of other individuals in the community. And we definitely advocate for them, and we would love to have that happen sooner rather than later. The other side of that is what can we provide now for the staff, for the faculty to feel comfortable coming back into the classroom? What PPE is needed? What might help in the classroom? Is that plexiglass dividers on tables? Is that spacing the desk out 6 feet apart? Is that moving into a larger space? Is that the difference of a MERV 8 filter versus a MERV 13 filter? We'll do that. And we've spent a significant amount of money on PPE because our goal is to have people safe and to feel comfortable coming back into that classroom. It goes back to those conversations. Some cannot be accommodated, and we simply have to move in a different direction and do something and have additional conversations around their personal issues with that and what may be impacting them. And we'll do that. And HR has stepped up with that. Administrators have stepped up with that. And we have a close relationship with both of our unions because of ongoing conversations. And that's really where we solve things, is in those communications and those conversations that we have.
Mm-hmm. Thank you. Fred, one of the things that comes up, and a question that came up that was sent in prior to the forum, dealt with liability and how you as superintendents and school leaders and board presidents deal with liability around this. And the question, I think, was really directed at, if something goes wrong, how's the district deal with it from a liability perspective? And how do you think about that? How do you deal with that?
Well, every district, excuse me, every district has liability issues, and they are covered through the an at-risk management pool. There's actually a couple different, pools in the state that cover all the districts in the state of Washington. And so the key word isn't just liability, Michael, it's coverage. So, we're all a part of the at-risk management pool. We have coverage for liability for a lot of situations, but they were very clear to all districts in the state about what it takes to receive coverage when it came to COVID litigation. So we just follow the guidelines or the recommendations, actually the expectations of the at-risk management pool, and they tied everything to the local Department of Health's recommendations. So coverage
that's pretty significant guidance right there, from the standpoint that if your insurer is looking at you and saying you only have insurance coverage if you follow these guidelines, but you're pretty well there, aren't you?
Yeah, we are right there, and I think every board, when we meet as a region of Northwest superintendents, you hear all of them talk about the importance of following the guidance of the local health department, and they lead their boards in that discussion as well. And boards won't step out and take a risk without the coverage as necessary. But we're there, and that's why we're seeing schools opening up at this point.
Yeah, I loved Eric's quote around never wasting a good crisis, and certainly this has been such an ongoing crisis. There's been lots of opportunities to not waste it, but we have learned some things here, and we've learned some things about teaching and learning. We've been surprised. Amber got an environmental education program, a big boost in that was unanticipated as a result of this. And I think we've discovered that some kids really thrive in a hybrid situation. And we hear from those students and parents as well saying, hey, I love this. I love the hybrid situation. And I found that as a match for me. So what have we learned that we want to hang on to and we want to carry forward, and that is going to change our practice in the future as a result of this?
Yeah, can I answer something real quick? Something Eric said that was really interesting that goes along with this is that the idea of the independent learner. And I remember after the first week or so, the elementary's done a good job, a great job of opening up. And I think the success of the elementary school has to do with the cooperation between the teachers and all of us together, putting together a good system. But the teaching by the teachers is amazing. But one teacher said to me, wow, after a few days of an actual live in-person time, they really did learn during this teleschooling. And it kind of goes back to what Eric said. How do we catch onto that? How do we keep that fire going? How do we instill that idea of independent learning even when they're in a live situation? And I think it's been interesting to see that all the way through the elementary, and now we're going to see what it's like in the middle school. But there's so much more. Eric mentioned the communication, the opportunity that we have with Zoom. It's communication with families. It's even what we can do for other students in a support fashion. I think that for me to list all the different things that could come out of it, I mean, I probably could sit here and come up with a lot of different ideas because I want to think outside the box, but that's where I just want to stay. I believe we're in a position like the preschool learned about the outside that Amber had talked about. You know, if it wasn't for COVID, you wouldn't have had this happen for that school over there. There are so many things that could be a positive for us if we learn to utilize it. But to say exactly what those are right now is kind of difficult because we're also engrossed in making it safe for everyone to be in the building and when is the right time to come into the building. But there are too many things that we can learn from this. And I'm actually excited about jumping into that conversation as we go.
Great. Eric, yeah.
You know, Michael, going through this, you know, you hear about this breakdown, and it's one of the questions. The fact is that we put a tremendous amount of work into this distance learning model. And I really feel like our staff, our faculty stepped up and really met our students. And really what we're seeing now is we were successful in this. In the distance learning. When you look at the universal screener that we have and we do the benchmark testing throughout the year, we really haven't experienced the regression that we thought we would with COVID. So it's really meeting those students now where they're at and how do we move them forward? How do we take this new independent learner who has technology skills, who's used to being on a Chromebook, okay, even a kindergarten or first grader who's logging into Google Meets, how do we keep that going when they're in person? And at the high school level, how do we better prepare them for the next step in their life, whether that's a university, a college, a career? How do we get away from X amount of number of hours in a seat? That's the requirement. And we're starting to see a little bit of movement at the state level with a pilot bill out there for year-round schooling and some flexibility at the district level that might allow us to do some of those creative things. But we have to have that at the state level first to allow us. We all could sit here and throw out incredible ideals of where we'd like to go with this. It's a matter of having that guidance that allows us to do that. And over the next month, the spitballs are going to be formed into our plans for the fall and what that's going to look like based on the guidance given to us from OSPI. You know, I really think this is an opportunity for us to really move education forward. We never want to get back to that normal where we were. This has pushed us forward into a new norm for public education.
Carl.
So I think one of the things for me that the pandemic has highlighted is what we've already known and talked about for a number of years. And that is the importance of knowing your students. because it is true that there are some kids who are thriving. It is equally true that there are a lot of kids who not only are not thriving, but are not doing well. And some of those kids are kids who we would not have expected to struggle because they are traditionally high achievers who are experiencing social emotional problems because of the extended period of isolation. And then you have kids again, and I don't want to underrepresent the number of students who are doing well, because there certainly are kids who are doing well. But to me, the point is, unless you recognize that the only way forward is becoming more sensitive to students' individual needs and figuring out creative and sustainable ways to accommodate for those needs, we're going to fall right back into a one-size-fits-all. And if the one size is computer-based instruction and a heavy emphasis on remote learning, we're going to have some kids who fall right smack dab through the cracks. And yet, if we pretend that the old model is more effective than computer-aided remote instruction for some students who do really well, then we're also missing the boat. So I think it underscores what's so darn difficult about this business. And that is that to be successful, you have to really be attuned to all of the different and varied needs.
And Carl, you didn't come out and say it, but I think you were inferring it, though the islands are not very demographically diverse or culturally or ethnically diverse. Certainly the effect on different groups of students has been more profound than others and has required much greater attention, which has raised equity issues throughout the country in terms of how well people have done in this. And I think your comments were getting at that and making some thoughts about it. What do we do going forward if you can take this opportunity and make specific requests of parents or students or community about what you need from them or what kind of support you need going forward? What would you say? What would it be if you could make a specific request for them?
I don't know. I really think that the constant communication is important, and I hope that they feel. I hope that that we convey that we do listen and that we want the communication to continue. We don't have an easy button and an easy answer all the time, but it is important that we continue to hear. And at the same time, I'd hope that there's also some some grace as well, because we're trying to make the decisions that the best that we can for the safety of all. And yet, I can't help but echo, Carl has to say that, there are several students who have done well in the remote setting, but there's a lot of students who have been struggling and those you wouldn't expect. And so when we do make some decisions, we're trying to take in the totality of all the students. And we just, I would hope that the communities would know that we're part of the community and we want to serve our kids and families the best that we possibly can, and to continue to communicate, because there are things that we're learning even every day, whether it's from, a health official or whether it's from a parent or a student. So I would encourage the conversations, but also a belief that the board and the school districts are, and I'm sure these other schools as well, are trying to make the best informed decisions possible.
Amber.
I would just add to communicating to the parents that while we have a responsibility, while the children are in our care, to do our best to reduce the risk, they also have a responsibility to our school, to our organization, to our community to do their part. So encouraging them to stay informed of what the recommendations are currently in our community, but also understanding that, and I hope finding the appreciation that everyone really is doing the best they can under these circumstances. We've had a couple of incidences where I've had parents who have wanted everyone to, especially around the holidays when numbers were increasing and there was a lot of attention on travel and guests in your home. There was a conversation between a couple of families about having everyone sign a contract saying that these are the things that they would abide by. And it felt punitive rather than supportive. And we've really worked hard, and I think we need to continue to work hard in our community to support everyone and encourage them to make a decision that's beneficial to the community as a whole, but lessening the witch hunt, making it not that we're out to show that people are doing wrong, but encourage people to do right, whatever that is for them. And it is different for all of us, but communicating that we do, asking the parents to share in that responsibility to keep our community healthy and to keep our kids healthy. I think that would be my big ask. And, I really believe that we've been able to do that so far. And people are making decisions there, that aren't necessarily what they want to do, but what they do feel like their responsibility is. So I appreciate that.
Thank you. Thank you, Amber. John.
To answer your question, I guess my single ask following this, and rather than I don't like the phrase pandemic breakdown, I would call it a pandemic disruption, because I don't believe it broke down anything. I just believe it disrupted our normal educational standards or way of doing business. So one thing it disrupted was just being in person and not having as much connectivity with technology. And as we all know, the younger generation is much more adept at technology than I am anyway. I don't know about the rest of you. But they have taught us a lot. And my ask would be for the community to support that. And I think we've all talked about parents becoming part of this decision-making process. And I certainly support that. And parents in our community have been very vocal, and we've listened to all of them. But almost as important is the entire community supporting what we're doing. And I agree with Amber that and this has not happened on our island as far as any kind of shaming or anything like that. But during this whole process, we've had community members who have expertise in various fields, whether it's geology or geography or astrophysics, be able to participate via Zoom in the student classroom and bring their knowledge and a different voice to our students. And that's been something that I think should continue. And even if you're sitting in the classroom, we still have, everyone has a computer in our classrooms, and we can have someone from any country in the world give a lesson on something or just share their experiences, which broadens the horizons of all the students. So my ask would be for the community to continue to participate, bring ideas. Say I've got a friend in Denmark who builds boats, who can show you how to lay out all the lines of a boat, which would be very helpful in many different areas of learning. So that's my ask.
Good. Thank you, John.
So, Michael, I think my ask would be to honor the work that has been done. Our students have worked extremely hard. Our parents have sacrificed. Our staff, our faculty, our admin team, our school board, they've worked tremendously hard over the last year, and to honor that, to give each other grace, to build that relationship, and to understand it takes all of us in Island then, right, to educate a child. And, we can do that together.
Thank you. Thank you, Eric. Carl, a closing request or a closing comment?
I'm just really struck by what Eric said. And I would echo that. I think people really have sacrificed a lot. We certainly, none of us have been at our best at every given moment during the last year. But people have tried, and I've seen families, I've seen staff, I've seen board directors, I've seen school administrators, and kids just make tremendous efforts and deal with tremendous challenges. And I think that to the extent that we can recognize that and appreciate that and know that it's going, as Eric said, to take all of us to rebuild once things begin to settle down, that would be my ask.
Thank you. And that's it. And on behalf of the San Juan Islands Community Network, our host, I just want to speak my gratitude and deep appreciation for the work you do as leaders in our community. And I'm honored to have been able to facilitate this forum tonight. Thank you so much. And Larry, take us out.
Thank you.
Great. Well, I want to thank everybody as well. It was a very, very interesting conversation, and I took away so much from it. I want to remind everybody, and maybe this includes the panelists as well as the attendees, we do have a survey that hopefully, with the technology working, should come up at the end of this gathering, and there will also be a recording of this forum on our site, SJICN.org, probably in a day or two at the most. And we'll have it up and laid out in chapters according to the questions that were provided. And I really would encourage everybody to fill out that survey, because it gives us feedback as to how well we did with this forum, suggestions on how we can improve it, and also dealing with other topics, because we plan to cover a lot of other topics using this technology. I would like to say that if you have updates, any of you school leaders, with what's going on or ideas or suggestions, we do have a particular area on our site, the education area, which is where our forums exist and where there's also additional information. We welcome updates from all of you, and hopefully people will come and join us. We also have information there from the Department of Health. Just SJICN, what I loved about how this forum went is we're taking away learnings from even crises like this to come up with solutions. And what's so great about having all of you on from different schools, even though you get together on a regular basis with Frank James and with yourself discussing this, is to put it in this format where we really can allow you to come up with ideas that can be shared in other schools. And I think one of the most important things that you said, which is really critical, and I believe John was the one who mentioned it, is really the idea that as a community, the community can come in and is a tremendous resource when it comes to the education of our youth. And I think there are tremendous opportunities for them to move into something beyond even project-based learning, but learning with an expert to deal with real issues that exist in our community and turn them into really 21st century learners and doers. So again, I want to thank Carl and Amber and Eric and Fred and John. It was a pleasure. We had invited all the other schools in the islands to join. For various reasons, they didn't. But they are always welcome as we continue, hopefully beyond COVID, to discuss what we can do to improve the quality of education for our youth and improve quality of life in our community. So with that, I'll do a final thank you to Michael, who is just so wonderful to have him really as a host. He's a marvelous host. He's a joy to work with, and we're having some fun with it. And hopefully we're coming up with some good communication out to our community, because all of these activities are activities, whether it's education or the economy, that really need the engagement of more people in our community. So again, thank you very much. Remember the survey. The survey will be on our site if for some reason we have a screw up here. But again, I want to thank you for all attending, and also our audience and the people who came and attended this forum and presented questions. We tried to take a number of them were on various subjects, and Michael tried to elaborate on those, but we appreciate everyone who did submit their questions: Diane Hollis, Stephanie Buffum, Karen Meenan, and others. So, and also Dr. Fisher. Again, have a wonderful evening, and thank you again for your time and participation.
Thanks, everyone.
Thank you.
Thank you.
Bye.
Thank you. Appreciate it. Have a good night.